Okay, doctorarjaybe here, and I wanted to talk about ulcers. So, the most common type of ulcer that we find is an ulcer of the stomach. The stomach has a lining which protects it from the acid that it produces. We use the acid in our stomach to help break down food, to kill bacteria, and this acid is basically hydrochloric acid, which is an acid that they actually use in industry for things like cleaning rust or debris off of metal. So it's a powerful acid in any event. This acid, like I said, is used to kill the bacteria that might be in our food, to help to start breaking down the food. So it's an important part of our digestion. But it's so strong that it can actually cause problems for ourselves too, if it gets in the wrong place. When an ulcer develops, it's basically a hole in this protective lining of the stomach, which allows the stomach acid to then cause injury to the stomach. And this can be accompanied by a burning sensation in the stomach. It can be accompanied by bleeding if it hits a blood vessel. It can be accompanied by stomach pains. The usual thing these days, because we have ulcer medications, is to put somebody on one of the ulcer medications for a while, to see if we can allow the stomach to heal itself. But by cutting back the stomach acid in the stomach, this allows the stomach to heal the injury that it has and give it some time. Usually with this, we try to do this for maybe no more than a few weeks to a month. If things don't improve, at that point, then we usually try to do some testing to try to figure out what else is going on. One of the concerns I have is the fact that most of these ulcer medications are over the counter now. And a person could treat themselves for a stomach ulcer without knowing whether the damage was repaired or not. Another thing to be concerned about with ulcers is that some of the ulcers are actually an infection of the stomach, and there's no way to tell if you have that infection if you just kind of treat yourself. A further problem is that some of these ulcers could actually be a stomach cancer. And by delaying treatment of that, it might decrease the chances for success. Usually, we would recommend the person go for a scope of the stomach by one of the gastroenterologists, where they put a camera basically into the stomach, take a look at the stomach lining, see where the damage is. They also have ways of putting some tools in the stomach to get a biopsy of the area. This is so that they don't miss the possibility that the stomach ulcer is really a stomach tumor. And they also will do some testing for bacteria, because if it's a stomach infection, the infection needs to be treated to heal the ulcer. They did some work at one of the research centers here in Chicago area, actually, where they found that a lot of the ulcers were caused by a certain bacteria invading the stomach lining. And so these days, one of the ways to treat the stomach ulcers is to use antibiotics. If they can determine that the stomach ulcer was caused by this bacteria, then using antibiotics to clear the bacteria is the treatment for the ulcer. So, things have definitely changed for ulcer therapy. When I started in medicine, people would be hospitalized for their ulcer, and they would be given milk to drink because they knew that milk would buffer the stomach acid. Also, they would use antacid products like Malox to be given around the clock to treat the acid in the stomach. So it was common when you had a patient in the hospital with an ulcer that you saw a container of milk on their bedstand, because that's what they were drinking all day long, was milk and Malox. Once they found medications that could reduce the acid, everything basically changed. The ulcers were treated most of the time as an outpatient, and it was a lot easier to treat patients at that point. In very severe cases, sometimes stomach surgery is done, where a portion of the stomach is removed to take care of the ulcer problem. And basically what they try to do is to remove the ulcer and also a portion of the stomach that produces all the acid. So in this way, the hope is that the ulcer will not return after surgery. Okay, so this is just an idea, a little bit of an idea of what things are all about when you talk about an ulcer.